creed or credo. But even as we seem helpless in the hand of fate, we can reduce our exposure by taking proactive steps. The mega million business of insurance is based upon that simple concept, that we can all plan ahead and achieve risk reduction tremendously and effectively. 5 years ago, we recognized the need to develop both proactive strategies and emergency measures to curb accidents. We were worried by the high rate of avoidable deaths from roads and from homes, road accidents, and fatality and distresses from houses. Victims were dying because there were no one to render help by taking them to the nearest hospital. And even though we were lucky, some still survived, unlucky for some because they lost their life. But nothing, not just armchair critics, ordinary campaign will save life, but an effective emergency situation, an emergency system of care. That is why we plan ahead. We believe that many lives could be saved if at least two things had been adequately provided in our health sector over the years. Enough ambulance vehicles with trained personnel. 2, free treatment for accident victims in the first 24 hours that could determine whether they will live or die. We were also worried by the alarming statistics of the percentage of Lagosians within the productive age bracket incapacitated by one form of ailment or the other. Men and women who otherwise should constitute the productive workforce of the economy in our state, moved by their plight, compounded by high cost of medical services in the country. We decided on the options before us and came up with the idea of establishing the ambulance points along major highways in the state. Among other health programs such as free blindness prevention, free malaria treatment service, free medical service for young and the aged, free treatments of tuberculosis and free milk for children in the first year of our public schools. I must confess here today that I believe that the decision is one of the best that I've taken since I was elected in 1999. The deluge of letters of appreciation, commendations, and prayers that I have received from many victims who were saved due to the quick intervention of our ambulance unit have inspired me to seek to even do more. And I hope that you've had one of the letters read here. I have hundreds of them, and I dedicate that one to you, the medical, particularly the paramedics and all the workers of the emergency ambulance and Los Angeles operators. As the Honorable Commissioner for Health, Dr. Lekekwicho, said earlier on, addresses of the 2,251 cases that we have dealt with from year 2001 to year 2003, 1,241 emergency accident cases lost their lives. There's a challenge for us to work towards zero tolerance for deaths from accidents. I must thank the members of the State Executive Council for sharing this dream with me, and the leaders and members of our great party for providing the supportive inspiration to achieve our dreams. This is why I'm particularly delighted to be here today to launch our new mobile intensive ambulance unit recently acquired by this government to complement the regular ambulance services we have been using in the past 5 years. According to the World Health Organization, road traffic injuries, that is what they refer to as RTI, have become a major global public health and development issue, which requires urgent action worldwide. It disproportionately affected certain vulnerable groups of road users, including pedestrians, cyclists, motorcyclists, and passengers, often of the public transport. It further states that in year 2000 alone, an estimated 1.26 million people worldwide died as a result of road traffic injuries. They are also responsible for 25% of all deaths due to injury. With over 1 million people killed each year, it has become the 10th leading cause of death worldwide, and with another 20 million more injured or disabled. It is the 9th leading cause of disability worldwide. Worse still, it is ominously projected to become the 3rd leading cause of death and disability by year 2020. Ahead of such other health problems as malaria, tuberculosis, and HIV/AIDS, a responsible government must rise up to the challenge of the 21st century. The challenge ahead is monumental, and we must pose ready to convert tragedy to prosperity. Over the years, we have witnessed varying degrees of accident, emergency, and trauma cases, such as January 27th bomb explosion at Ikeja Cantonment, both mishaps, fire accidents, collapsed buildings, gunshots, etc. All these were sad reminders to us that we are in need of more facilities in our hospitals, and especially the mobile intensive care ambulance units, which are part of the solution to our myriad of emergency accidents and trauma cases. When I heard a couple of weeks ago that UNICEF, an international organization, provided $14.5 billion to purchase ambulances for the federal government for the purpose of assisting road traffic victims in Nigeria, I became even convinced that now they are woke up and we are on the right track. Finally, they woke up to their responsibilities. We can now give them a hand, maybe. I believe the money spent to procure these 20 mobile units, which are about to launch today, is money well spent. I am convinced further that Lagos State still retains a prestigious status as a trailblazer and a leading light for this country. thing demonstrates the fact that we stand with the world on the issue of safety on the roads, than the fact that we are launching the mobile ambulance unit on the same day that the whole world, under the auspices of the World Health Organization, on the same period they are marking this year's World Health Day. It is even more flattering that the global machinery and control has put the issue of road safety on the agenda by choosing the theme road safety. The procurement and the launch of today's Lasambo's new unit could not have become a more auspicious time. This is the year of to save it all. Our comprehensive approach to the prevention of accidents and reduction of emergencies will not be complete without the reorganization and full development of comprehensive and effective system of trauma care. This system must encompass pre-hospital and in-hospital care, rehabilitation of survivors of road traffic accidents, and the adoption of a trauma registry to collect detailed data on the consequences and cause of road traffic injuries or domestic injuries, other trauma such as heart failure, asthma, and sudden attacks. There is no doubt that we have started some of these, but it is the determination of this government to build upon what we have in place, include clinical capabilities and staffing, equipment and supplies, quality improvement programs, continuing education, and possibly research. For that, you could see that these vehicles that you are looking at there are not just ordinary ambulances. They are moving hospitals. They are moving hospitals. Other distress victims that you are equipped with in these ambulances, the mobile unit is ventilator that we assist an accident victim to breathe if he cannot breathe due to chest or head injury. Check to check blood sugar for those who are unconscious, probably due to low blood sugar. Pulse oximeter to check the level of oxygen in the blood and in pulse. Defibrillator to short start the heart that has stopped breathing to bring it back to life. Immobilization set to immobilize neck, back, waist, limbs, and head suspected to be a fracture to avoid paralysis. Complete nursing care in motion. Suction machine to clear the lungs and airways in case they are blocked by blood, saliva, foreign body, or other items. Rolling cord with the stretcher and wheel to enable fast movement of the patient from the site of accident or incident to the MCU, that mobile care unit. Minor surgery could be performed in that vehicle to have a rolling check for breathing, blood pressure monitoring, other uses of the unit. This is not just for the accident. Distressed victims of heart attack can call the ambulance immediately and they will respond. Asthmatic people can call. People in coma, fall in the homes, people with breathing problems, even swimming pool injuries. people with breathing problems due to bad pneumonia, shock, diabetics, drowning in pool or any part, air crashes, gunshots, gun wounds. Today, I'm very, very proud of what it is that we brought to Nigeria. In realization of the sophisticated level of this mobile intensive care unit, you've had our experts talking to you about it uses diesel and it's a Mercedes, and the fact, again, a 2-year warranty and maintenance arrangement is covered by our memorandum of understanding with the expert consultant. We have all that one to cover the line. The training program you have seen demonstrated is not just by chance. May I use this opportunity to thank you, the paramedics, for responding effectively to this training. Mr. Medicroft, can you please step forward again? He is the president of the London Association of the Ambulance Corps. He is the trainer of our people. He's brought all the way from UK. He has been here for a couple of weeks, and he will continue the training and program. We brought the best, and I thank you for responding positively. You are very welcome once again. Thank you. It is to the glory of God, total commitment to humanity, our dedication to the welfare of our people as a responsible government. All democracy is all about is about life, promotion of good freedom for the people, the right and prevention of tyranny, and promotion of the prosperity. Without good health, without health care services, without caring for those people, we cannot guarantee productive and promotion of our economy. We cannot realize those potentials. How long are we been talking about Nigeria potentials without translating it to reality? We have what it takes. We have very brilliant doctors, brilliant and well-trained nurses that they can match anybody in the world. As I travel around, our women who are nurses from Nigeria, they took pride of place in American hospitals. They are in UK, performing wonders. Then, what are we doing? Not committing more to the domestic need of our people. We are going to continue to do that. Europe, these medical workers have received a series of letters and equally suggestions from you. Those who are not getting some of the allowances that you should be getting now, we are considering and reviewing it. You will get it. I've gotten your plea. In fact that you even plead for them. You send letters requesting and pleading for them, reminding us it's enough to give it to you because you did not make slight possibilities a threat. You did not move in a direction that will oppose danger to the people you are supposed to care about. I commend your effort. Gentlemen, it is therefore my singular honor to launch to the glory of God Almighty, for the care of our greatest number of our people, this mobile intensive care unit, for the safety and happiness of the citizens of Lagos State. God bless Lagos State. God bless all of you. Thank you very, very much.
Láàárín ìṣẹ́jú mẹ́ta péré, eléyìí ni ẹ̀dà ọ̀rọ̀ tí bí gómìnà bá wa sọ. Lẹ́yìn ìgbà tí wọ́n ti kí igbákejì gómìnà abẹnugan lẹ́kùn aṣòfin àti gbogbo wọn tó wà lórí àga ọlá, wọ́n náà dúpẹ́ lọ́wọ́ àwọn àjọ tó kún wa.
Wọ́n máa ń gbé gbogbo yẹn lókè. Wàá rí ẹ gbogbo yẹn lókè. Gbé lókè kan wọlé sí ìlú yìí. No, sir. Commissioner, okay. Let's come on. Commissioner.
I welcome the citizens of
And of course, for you to be able to monitor the patient's vital signs, we have
Doctor.
Let them do their job.
Doctor, your hands.
Of course, this is a mobile hospital. Before we call this machine. This machine is used to wrap a patient, like in case of shock, hypoxemia, a patient with low temperature. Temperature of the patient. Of course, we have our syringes, the needles, so that it does not bring the patient to injury. You have to put all those things. Okay, there is laceration and then the chop, all these This is airways equipment. This airways is very useful. Like you want to perform tracheostomy, intubation for a patient. Because the vaccine is here, just start the vaccine.
I hope you won't forget the battery there, or use to have put to my table.
Or we use the ventilation. All this one is just effort to pushing the oxygen to the patient. But if the brain is being oxygen for more than 2 minutes, that patient has become ventilated. And we don't want that to happen to our patient. Any patient that is being resuscitated by lateral flow, the patient just has to do. And you can see that some of them have already seen the patient. The vital form of well-sophisticated acute ambulance. This is used to mobilize the sick mind and to prevent paralysis. Majority of our people, if they are improperly rescued in an accident, they end up being paralyzed. We are able to use this on their neck and use that spinal cord. There's no danger of paralysis. I have dressing material. All these dressing materials are necessary for you in case.
That's okay.
Thank you. And of course, this is our output sheet. We check the then we have the